Good afternoon, everybody. I'm going to turn it over to Shelley Stein, the chairwoman of Genesee County, to do a introduction this morning, and then we'll kick it back and go from there. So, Shelley, you unmuted?
I am, sir. Paul, good afternoon, and thank you. I just wanted to address the fact that the loss of community neighbors to COVID-19 is significantly felt by our entire communities, and our sympathies go out to their families as they grieve their loved ones. We ask that you know that you are not alone and that we join you in your time of loss. It is terribly difficult to understand the fast pace of changes in our daily lives and the chaos that it constantly creates in our schedules and anxiety. But, together through clear communication, we will work through each challenge and validate our decisions and our actions. And I wanted to say thank you to our county staff members who are working from home at their offices, and to say that you're very important to continue the foundation of county government. And a special, sincere thank you to all of our public health, our emergency management, and our public safety officers, our healthcare workers who are on the front lines keeping us safer. And it really is our civic responsibility to react, respond, and listen to the good advice that's given to us by our professionals. Paul Pettit, our public health director, his staff and his time certainly is not wasted by making sure that all of the requirements and the good guidance is followed so that we can get to a point where we have more recovered than we do active cases. So thank you, one and all. Paul?
Thank you, Chairman Stein. Appreciate those words, and I would echo those, especially around those that we've lost to COVID-19 specifically. Those are challenging times for anybody whenever we have a loss within our family and friend networks. And, we definitely send our condolences out to those that are suffering and dealing and mourning those losses. So again, my name is Paul Pettit. I'm Public Health Director for Genesee and Orleans County, and it's Friday afternoon. And we're back here again doing our weekly in-person update. And again, at the front end, I just want to take a quick moment and just reach out and talk to all of our residents in both Genesee and Orleans County, and thank the strong majority of you for doing great work, for hunkering down, for continuing to maybe do things that we don't want to stay home, to not be out and about, to social distance. Again, to do all these different requirements and recommendations that are out there. I personally know it's not easy. My family and my friends are all doing the same thing, and we talk frequently, again, over the phone and via social media and, these social distancing platforms. But it is challenging and it's tiring, and we understand that. And, our goal here is to continue to, work through this situation, to work through these unprecedented times, and hopefully get to a place and a point where we can start to relax some of these restrictions and get back to some sense of the old normal. Again, we've heard the term a lot, new normal, and I think it is going to be a bit of a road in front of us till we're back to potentially what things used to look like in some sense. But people are still being compliant and hunkering down and doing the hard work, and I just want to say thank you to everyone that's doing that. We have been able to flatten the curve. I firmly believe that the numbers and the lower numbers that we've seen over the last month and a half or so are a direct result of the hard work and the dedication that folks are making to be compliant and to adhere to the guidelines. So as we move forward, again, I just wanted to send out a quick thank you, and I appreciate the cooperation and everybody doing their part and working hard towards, again, protecting the residents of Genesee and Orleans County. So as we've done every Friday here, I'm going to just go through some situational updates and talk through some of the current numbers. We do have a few new things that we're going to talk about today that we're launching and releasing to the public, and so I'll explain a few of those, and then obviously we'll have an opportunity to have some Q&A with our media folks and go from there. So again, throughout the week, we put out our numbers. My PIOs, Noah Goodrich-Cressy and Mary Hamilton, are doing a great job every day of crunching the numbers. Those are coming directly from our EPI staff. But it is a lot of information to keep track of and to try to, put it in a way that's easy to understand. But I do feel this is very important for us to do. It's very important that you in the community know what's going on with our numbers locally. This is the best way to get you the information as factually and as real time as we can. So again, there's a lot of effort that goes into this, and we're hopeful that this is helpful to everybody. Again, to glean a little bit into what's going on in our local community, because again, we want it to be factual, we want it to be informational and helpful to everybody. So again, we cut off at 2 o'clock, but as of 2 p.m. today, Genesee County has received one new positive case of COVID-19. So we now have a total of 142 positive cases in Genesee County. The positive case resides in the town of Elba, and the case is in their 50s. The individual's in their 50s. The newly positive individual was not on quarantine prior to becoming symptomatic and getting swabbed. 5 of the previous positive cases have recovered and have been released from mandatory isolation. And 1 of the total active cases for Genesee County is hospitalized. Jumping over to Orleans County, we have received 10 new positive cases of COVID-19. Again, that is 10 new cases notified today for a total of 75 positive cases. 1 of the positive cases resides in the town of Barry, and 1 resides in the town of Kendall. 8 of the positive cases are from the villages of Orleans Health and Rehab Facility in Albion. 1 of the individuals in their 30s, 1 in their 40s, 2 in their 60s, 1 in their 70s, and 3 are in their 80s, and 2 individuals are in their 90s or older. 1 of the new positive individuals was on quarantine prior to becoming symptomatic. 8 of the total active cases are hospitalized for Orleans County. So again, we've been sharing a little bit more information this week. We put out a press release earlier on in the week detailing some of the issues that we're having at the villages in Orleans County related to COVID-19. And, again, reporting today, the health department has been made aware of 2 additional deaths related to COVID-19 out of the villages of Orleans. Both of those individuals were over the age of 65. And again, as we commented earlier, our deepest condolences and, our thoughts are with the family and friends of these individuals during this time. Again, we talked about that a little bit earlier. These are very challenging times, and our deepest condolences to them during this time. So cumulative data-wise, I'm just going to run through this real quick. Genesee County currently now has a total of 142 positives. We have 678 negatives. We have 70 folks that are under mandatory isolation. We have 72 under mandatory quarantine, 3 deaths, and we have 69 that have recovered and cleared isolation. In Orleans County, we now have 75 positive cases. We have 431 negative cases. 46 are under mandatory isolation, 37 under mandatory quarantine, 7 deaths, and 22 recovered. So out of all those numbers, one that I wanted to highlight was a total here for both counties, which is 91 total recovered. So again, as we continue to move day by day and week by week through this crisis locally, we're able to see that there is positive news. We are clearing people from the back end. They've recovered. They've worked their way through their COVID illness, and again, we're happy to see that number continue to rise day by day, week by week. So one of the things, again, that's available for folks on the website to look at is the age breakdown. So again, we're trying to give folks a better glimpse of what's going on in our communities around what ages, people are that have been testing positive for COVID-19. And again, take some time to look at that map. I'm not going to read through all that now, but you can see that it's well across the board, basically from all of our different cohorts. We have it by decades. You can see that we have positive cases across the board in all the different age groups. And again, we'd encourage folks to go to our online website. We're going to actually be bringing that up here. Hopefully we can share our screen and allow folks to see what that looks like. There is a link on our websites, and I assume widely dispersed now. It's on our daily briefings. And hopefully that tool, again, is very valuable for residents to be able to hop on and see what our updated numbers are. Again, it's fairly robust. We're tracking cumulative data. We're tracking active data. And again, a big shout out to Genesee County Planning and Aaron Pence for doing a lot of the legwork and getting that up and running. Again, we're very pleased with, the efforts that have been put into that and the information that is available for folks. So are we sharing the screen yet? Working on it. Okay. So one of the things that we're doing is adding some new data to our charts in the mapping system today. Again, we wanted to make changes that would work towards relaying some information with more clarity and making sure that, again, our residents had as much information that we feel is hopefully available and appropriate, so we can, again, keep people informed of what's going on locally. So a couple things here on the chart that we're seeing. We added in a pie chart that's next to the map. And one of the things, and I'm going to talk through this a little bit, but we added this in because we really wanted to let the public know that there is some differentiations between what we're seeing related to community cases versus regulated non-county public regulated facilities. And, again, we've been talking about the data and we know we have a couple of facilities, particularly the ICE Detention Center in Batavia and the villages in Orleans County that are driving a lot of these numbers. So we thought it was important to try to break some of this out so people had a clearer view of what was going on and the differentiation between the two of these. So again, we've added some charts here that hopefully will be a little more helpful in clarifying. You can see the percentages anyways, and we're going to keep refining the map and adding in some different information. So hopefully that'll continue to evolve as we go forward. But we are launching that today. Another thing that will be available that we're going to be including in our daily briefings is a non-county public regulated facilities chart. And again, that'll also be up on our websites. And again, here, the idea is just to, again, help folks see and get a better, clearer understanding of what's going on in some of these non-county regulated facilities. So again, that'll be available, but just in summary right now, in Genesee County, the Buffalo Federal Detention Center has had 49 positive cases and no deaths. The Batavia VA Medical Center, the federal VA, has had 3 positive cases and no deaths. The Villages of Orleans Health and Rehab Facility has had 38 positive cases and 7 deaths. So again, we're going to continue to add to this as we go along. We're not just specifying these specific locations as other, if and when, I guess, other facilities come online with positive cases, other nursing homes, other non-county regulated facilities. So again, these are ones that are overseen by the state of New York or the federal government. We do not have jurisdiction over them. We are involved in the process of, obviously, we receive the positive cases and we work with them, to again identify potential close contacts, and any of those community contacts, essentially the employees or other folks that may have been in contact that live within Genesee or Orleans County. We follow up with the case contacting and we put them under quarantine and or isolation if they're swabbed and become positive. If they live in a surrounding county, that occurs within that county's jurisdiction. So again, we're doing this due to the increased number of positive cases at these specific regulated facilities. And, again, we're hopeful that this, again, provides a little bit of a glimpse into what's going on in our community. And, again, looking specifically at Orleans County here, you can see out of our total positives, 52% of the positives are from one facility. And this is residential where it's contained within, that setting. And, again, any staff members, et cetera, don't count against those numbers. Those 38 are among the residents. Any staff, et cetera, that work there that live in our community would count on our community side. So again, we're going to continue to provide those moving forward, and we can, we'll add new facilities on as appropriate and as we move forward. So one thing we want to do is just remind folks that although we see a lot of activity in specific facilities here in our county, it is widespread. I mean, we are reporting daily community spread cases. We don't want anybody to get a false sense of security that they're not, we're not seeing activity throughout the counties. I believe there's only one town remaining in the 2-county region that does not have a positive case. And again, that does not mean that it is not there. My guess is, again, it's rural based and testing, again, is not widely available to the level that we'd like to see. So we just want to make sure folks are really remembering that the virus is prevalent and pervasive throughout both Genesee and Orleans County. And again, those are the reasons why we have all these different restrictions in place. So we want to continue to remind folks that it's very important for continued frequent hand washing, making sure we're social distancing, staying, again, 6 feet apart. not going out unless we really have to. Again, when we're going out to the stores and different areas within our community to shop and to get things that we need, attempt to do that as minimal as possible. It's not a time to take the whole family out shopping. Let's make sure we try to minimize the traffic and the folks within the stores. Again, masking requirements are out there at this time, and we're encouraging everybody to wear masks. And this is not, again, about protecting you per se. I mean, there is a level of protection, but it's about protecting others. We know that the cloth face mask or the everyday use surgical mask, they're not really meant to protect the individual wearer. They're not an N95. They're not fit tested. These are to protect others, so that when you're out and about, as you're talking or coughing, those type of activities, you're not spraying, around within your 6-foot area and potentially contaminating other people. So again, this is, we're still encouraging folks to, do your best to social distance and stay home if you can, especially if you're symptomatic. We don't want anybody out and about. If you do need to seek medical care, make sure you're calling ahead, talking to your doctor, and letting folks know if you are going to the health systems that you're coming ahead of time if you're symptomatic, because again, we don't want to potentially expose our healthcare workers and potentially cause them some additional issues that they may have to deal with. So again, this is a time to be kind and think of others during this time. So again, along the nursing homes, everybody I'm sure has seen that the governor has put out some new guidance around nursing homes and directives that they are now mandated to do. Again, this is not anything that the local health department is directly involved with, but there is information out there, obviously, around nursing homes and reports that they have to, relay positive cases and deaths within the nursing homes to family members within 24 hours. That information is there, and there is a hotline number. I'm going to say it real quick, but again, this is available in all the literature, but it's 1-833-249-8499. And there's also an online form that's available, again, in our materials, that if, anybody from the public has concerns that the nursing homes, not just ours here, but across the state, are not being compliant and not following the rules and the directives that have been put forth by the governor, there is a way to, put in complaints, and then the state would be following up with their own investigations at some point. So a couple other operational updates to go through. Antibody testing, so that was obviously in the news this week around this 3,000 random sample pool that was taken by the state. Again, we know here in the Western region, there were 2 sites, one in Rochester and one in Buffalo, where they were just randomly sampling folks, again, trying to get a group representative sample from the community. And obviously those results are out, and it varies around depending on the region, but overall 13.9% had some level of antibody testing in their serology when they ran the results. Again, heavier downstate, not as much around here. I believe in the rest of the state, 32% of the samples, only 3.6 had antibodies present. So that would cover our region, obviously the Buffalo-Rochester region. So again, there's still very limited antibody testing out there. It's something that we are all asking for. We'd like to see more of. And there still is not a clear directive at the moment of if and when that's going to happen and how it's going to happen. But we will be relaying that information to you through our daily briefings and through our Friday afternoon chats, when we do have that information, because we do feel that's a very important tool and a key piece of understanding the issue here locally in Genesee and Orleans County. We know that our testing rates are still low, the amount of folks that have been tested overall and the number that have tested positive. And if you add that in with a 3.6% showing antibodies, that tells us that, based on, again, very limited data, that we still have a lot of folks in our community that have not tested positive and been exposed or have had the antibodies. So again, data is important. Data is going to drive a lot of what we do moving forward. Obviously, we heard the announcement again this week around some regional coordinators, Bob Duffy and Kathy Hopel in the Western and Finger Lakes region. And they're going to be talking and working with us at the public health level, but also with the other partners in our community to think about how and strategize the ways that we can move forward in a very safe and effective way. Everybody's chomping at the bit and wants to get things back up and running. And us also. We would love to see certain things happen. But again, we need more data. We need information to truly understand what's going on in our community so we can make smart decisions. The last thing we want to do is to rush ahead with things and find ourselves in a precarious situation where we now have a significant increase in cases, where if we were taking, again, some of these social mitigation strategies, masks, social distancing, staying home, those type of things, if we're able to kind of meld and blend that along with some common sense approaches to businesses and getting people back out in the communities, we're very hopeful that we can come up with a strategy, again, that is health focused, but also helps folks get back to work and doing the things that they need to do in their everyday lives. So again, swabbing continues to be very minimal. We do encourage folks to utilize Tent City at UMMC if you're symptomatic or concerned that you may have been exposed. My understanding is, again, that criteria is beginning to open up a little bit, but call ahead, go through the site if you need to. Again, we're aware of other testing sites in Rochester and Buffalo that are available. Some providers, again, locally within both of our communities are providing testing. So we'd encourage you to call and see if that's available. But again, if you are ill and you're symptomatic, we do not want you out and about into the communities or going to work. All right. Also, just again, a reminder, as I do every week, mental health issues, and folks with anxiety and maybe depression setting in, just due to the fact that people are locked in and staying home. We have obviously high lack in of socialization. And so with that comes, different potential mental health issues. So we want to make sure people are aware there is help out there, that there is a care and crisis helpline, which is available 24/7 in both Genesee and Orleans County, that if you're feeling like you need to talk to somebody, we strongly encourage you to take advantage of that and to make that contact. Both of our county mental health departments, along with community-based providers, are available and open and willing to talk and to work with anybody that may need that level of service. So we definitely would encourage folks to take advantage of that during this time if they need it. Just wrapping up here, a couple other things. Again, there's just some general information we've been putting out in our daily press briefings around, the CARES Act, donating blood through the Red Cross. The governor has extended his disaster emergency declaration through May 15th. And again, he mentioned yesterday or today, I believe, that he'll be making a decision in the next week or so whether he's going to extend that longer. So again, at this point, it goes till May 15th, and there should be a decision coming hopefully by the end of next week, whether May 15th will be the time frame where we start to look to, open some things back up, or if his declaration will continue or some modification thereof. Complaints are regarding businesses that may be open from an employer side. Again, we've encouraged folks to call the State Department of Labor, and again, there's a phone number available for that. New York State on pause, again, looking at non-essential or essential businesses and gatherings. There is a phone number and a website. Again, if folks feel there's violations occurring, that is the route to take. You need to call that number, put in a complaint via the website, and again, that will go up to the state and then back down to the locals to take a look at those different facilities or different areas where there may be gatherings. So again, there's different information out there, different ways that folks can engage and again, work through this time. So I'm going to wrap it up with that. That's all the basic information I wanted to share today. But again, this is a very fluid situation, and as we continue to wade into these waters, as I started, I want to thank folks for doing their part, for making these hard decisions and really protecting others during this time, especially the elderly, those with immune-compromised health systems, other underlying health issues. It's our civic duty, it's our social responsibility to do what we can to help others during this time. And again, we have a very large percentage of our population that is doing that, and I want to thank you for that. And with that, we'll unmute our media folks, and I'd be happy to take some questions. And I know we have Shelley's still on the line, and I believe Jay is also, if there's any questions targeted towards them that they may need to answer.
Paul, this is Dan Fisher. Our friends on the media. One, the FedStim 3.5 that was passed included $25 billion with regard to hopefully new and expanded testing capabilities across the country, which will hopefully also inure to hear those of us in New York State in particular. Another piece that Tom Reed, who has adopted us as a 27th Congressional District representative at the federal level, also indicated, and I know Shelley's going to be looking into this very specifically, there's $2.9 billion in direct aid in this new bill for dairy. And there also is a significant USDA purchase of food items and then distribution into the various food banks and the rest of the needed food stock and pop-up kind of drive-through opportunities for people to pick up both fresh but also continued, like the Food Link stock availability that's happening twice a month here in Genesee County. I know it's happening in Corfu and also being done right here in the city of Batavia with one of our local ministries. So those things hopefully are also going to start coming out of the federal government, but also inuring to the state of New York as far as some of the deficits and the needs that have been identified throughout this, particularly with the significant number of people who've had financial dislocations, but also their food deficits and ways to hopefully approach that. But for you folks in particular, it's this new hopeful, I guess what I would call supersizing of the testing capability and the things we don't presently know about this virus that you folks, even as much as you're doing, basically 7 days a week, 12 to 24 hours a day in some cases, trying to do with regard to both positive testing and then the contact tracing. We just have not had enough testing materials or the capability that we truly need, particularly in a state that's been somewhat of the epicenter of the pandemic.
Thanks, Jay. So again, we'll open it up to media here if you have any questions.
Paul, Dan Fisher at WBTA. You had said earlier that the number of individuals who had tested positive and have now recovered is, of course, obviously a hopeful sign. Is there anything else in the data that leads you to believe that we have peaked in the number of our positive cases in Orleans and Genesee County, or are we any closer to the reopening of this region?
Yeah. So, again, this is you guys have been asking this question every week, and I'm happy to try to answer it. The reality is it's hard to tell. We've been talking about the need for data, and without that, it's very hard to make good, educated, sound decisions and then get a good understanding of what's going on in our community. I would like to say that based on what we're seeing, we've been plateauing a little bit. Again, if you take out the regulated facilities and you look at our mapping profiles, you can see that they're fairly, there's a little bit of up and down, but overall they're fairly flat going along. We haven't really seen much of a decrease. But again, we're social distancing, we're keeping apart. There's minimal testing going on just because of availability and the screening criteria. But I think that, again, the work that's been done has put us in a very good position of, minimizing the impact locally. And, I think we are at a point where we can have some common sense and very candid discussions around if and when we reopen things. I'm personally at a point where I think it does make sense to have these conversations. I think if we approach opening up and relaxing some of these restrictions, again, with a health focus at the center of the lens, where we're, again, practicing some of these mitigation strategies around wearing a mask and isolating, social distancing within 6 feet or more, there is, I think, a path forward in how we can do this safely and make sure that our residents can be out and about and enjoying the community as the nicer weather rolls in at some point. So again, I think we are getting to that point. There's conversations that are starting, and I'm very hopeful that again we can do this in a very strategic and common sense way.
I have a question also now for Jay or Mrs. Stein. It's a political question. You almost hate to ask it, but we are probably one of the reddest states or reddest counties in New York State. And we are having a very difficult time getting the testing supplies from New York State. Other counties seem to be getting them in much greater proportions. Jay or Shelley, do you have a comment on that?
I'll comment first, and then Paul will correct me, and Shelley will correct both of us if we're wrong. I don't believe that this has anything to do with red or blue. There's just not enough test kits anywhere. This $25 billion, Dan, I believe, is trying to address that. Representative Reed, who I'm pretty sure is a Republican, who is, like I said, has adopted us as far as the 27th district, has made this a top priority as far as his office is concerned and his colleagues in the House of Representatives, that they recognize there's been this dearth of testing equipment and the kits that Paul and company rely on, including UMMC and what they've done to help us go back and forth. It has nothing to what I've heard people say has nothing to do with any political affiliation. This is a bipartisan, nonpartisan issue, and it's just a matter of getting valid and viable test kits into these communities and the testing to be able to ramp up, as Paul has always indicated, where the symptomology is and where then the contract tracing has to go from there.
Yeah, I would agree with Jay's assessment there. I'm not seeing any level of political interference with this. Locally, there's many counties all around the state that are all dealing with the same issue. Obviously, we've talked about this from day one with the downstate issues they've had with obviously very high level and aggressive spread of COVID-19. And obviously the state early on moved resources and really focused in down there, which did eat up a lot of the supply. I don't think that was political. I think it was responding to the crisis and putting resources at that time where they needed to be. But it's put us all in a position where we need to have them. And in order for us to really move forward in a safe and productive way, we need to get a handle and get additional data. So as Jay mentioned, to the funding that's coming through in this latest round, we're very hopeful that this funding will provide and really boost and ramp up the availability and the resources we need to do any level of testing we need. It would be great if anybody that needed to be tested and swabbed can be, and also on the antibody side, that anybody that thinks that maybe they had already been exposed or, just random sampling of our community members to, again, get a better idea of how many folks may have already had COVID-19 and had antibodies now.
Howard Owens with the Batavian here. How you doing, Paul?
Good. How are you, Howard?
Good. So I wanted to ask you a couple of questions about antibody test. I've been following what the governor's saying. I've been reading the news articles on this, and the couple of concerns that I have that I haven't seen been addressed is what's the rate of false positives? I wonder if you've heard anything, and also kind of what is being controlled for selection bias, because these antibody tests, as I understand it, are in places where people are going out to the public. They're going out in public, so already you're maybe getting people who are less risk averse being out there more often. And then also, since people don't have to take the test, there might be a bias towards people who think they might have been sick at one time wanting to get the test, and so that might create a selection bias. Do you have any concerns about the accuracy of these antibody tests?
Well, I mean, it's very early, right? So this was the first widespread swath here, so to speak, across the state to get an understanding of what's going on from an antibody perspective. Again, this was just a small random sampling that they tried doing here with the 3,000 tests. As far as false positives, I think it's really too early to tell, exactly, because again, there just hasn't been enough testing done. I mean, obviously with any testing that's done, there's always a concern with false positives or false negatives. But again, I think it's one of those things that we need to get a better understanding. And again, the way this was done, it was done, I'm not going to say covertly, but no one was really aware that it was being done. I think, again, the state wanted to get this out there and really just kind of do a very, very small random sampling across the state at very targeted locations, as you mentioned. So again, this is not representative potentially of all of our communities. As we know, there was no testing done specifically in Genesee or Orleans County. So again, it doesn't speak specifically locally to what we're seeing in our area, which we know is different than some of the urban centers where you have denser population settings, et cetera. So, I think that as we move forward, it's going to be very important that the antibody testing becomes more widespread and that we do look towards specific areas that we can, even put out there when it's readily available. Hey, if you were ill going back to a certain date and you felt you may have had COVID, you tested negative for the flu, but they didn't test you for COVID due to the availability of the test kits. Those are the type of people that we're going to want to talk to and potentially send for antibody testing so that we can see, again, did they have it or didn't they have it? So again, as we move forward, hopefully we can remove and move through some of those biases in the testing. At the moment, it's just not readily available enough, I think, to make any good, movement towards trying to eliminate some of those. But hopefully moving forward, we'll have better access.
And a follow-up on antibodies, what would you say to somebody who had an antibody test and it came back positive for antibodies? What confidence should they have that means anything? How should it affect their approach to the issues surrounding reinfection or anything else?
Yeah, that's a great question. Again, this is a novel virus. It's new. We don't know a lot about it yet. We're hearing stories, and I know you're an avid reader of these around the world, and different studies that are showing reinfection. They're showing mutations and second, potential mutated viruses, and people getting reinfected or infected with different strains. Obviously, typically when you have antibodies, that's what you want. That's in your body now, and it'll help you fight off infection if you were exposed again. I just believe it's too early to really get a good handle. I mean, we need a little more time behind us. We need to understand the virus a little bit better, and then that'll truly get us a better picture of, those that may have antibodies of their exposure risk. I think in general speak, typically if you have those antibodies, there's a level of protection there. But that doesn't really change, again, our desire to have folks practice these social mitigation strategies and, again, think of others during this time.
So you may have seen the story I did earlier in the week about the Buffalo Federal Detention Facility. One of the things I found surprising is that at that time, 45 people who tested positive, only 3 were symptomatic. So I'm wondering, can you tell us, of the people currently confirmed cases, how many of them are not symptomatic, and of the people that are being counted as recovered, how many of them were never symptomatic during their 2 weeks?
Yeah, I can't speak to specific data at the moment, Howard. I don't have that in front of me. We generally speaking, again, though, we do know that as time goes on, again, as my last comment, we learn more about this virus. We do know that up to 25% of folks at this time could potentially shed and spread the virus asymptomatically. And again, whether they're fully asymptomatic or they just have mild enough symptoms, it's really not registering to them. Again, it's hard to say specifically, but when you look at these regulated facilities, specifically the ICE facility or the villages, we have done and they are doing, more widespread swabbing of folks who are asymptomatic, because we know in those facilities with a higher level of potential exposure risk due to the environment, it's important to identify those folks and try to get them isolated from the other general folks in those facilities. So again, in the community, when we put folks on quarantine, we monitor them. That's the whole point of doing a 14-day period, which is the understood incubation period of COVID-19. We keep them under the observation and essentially locked home during that time period, and we monitor them every day. Currently, we are still checking on folks with one physical visit, along with at least one phone call, along with multiple temperature checks per day. And if anybody reports that they start feeling symptomatic during those visits, we swab them immediately. And you'll notice, again, on our reports when we put them out on a daily basis, the key line there is the one where we say that they were under quarantine. So that's an indicator right there that those folks were being monitored as a direct close contact under quarantine. Now they're positive. So again, we try to include that into our information so it does shed some light into that level of what you're asking.
Would it be possible going forward to get information on how many of the confirmed cases are symptomatic versus those that aren't, and then that same number for those that are then later reported as recovered, as to whether they ever were symptomatic?
I'm not going to commit to doing that. It's something we can take a look at. Again, trying to track and manage this data is cumbersome as it is, and we're trying to put out as much information as we can. We'll take a look at it, Howard. I'm not going to make any promises that we can do that. But if it's a way we can figure out to do that without an additional workload burden, again, as we're stretched trying to do the basic information we are doing now, we'll take a look at it.
Paul, with regard to the question that was raised about community and what you indicated as far as temperature checks and phone checks and physical checks, would you indicate that most of the people that are on your, so to speak, list have been compliant in both counties?
Absolutely. We've had great compliant folks. I mean, again, you're looking at rough number here, probably about 400 or so, 250 or so between the two counties that we've had under our care, so to speak, over the last month and a half. And we have had a small number that we've had some challenges with, and we've worked with law enforcement. But overall, the folks have been great. They understand why this is being done. And again, they're doing their part and wanting to make sure that they're protecting others in the community by staying home and making sure they're being compliant with the isolation or quarantine orders.
My last question is about children, Paul. There's been some stories this week about children being infected, and we've heard, one scanner call involving a 14-month-old with a fever and chills who was identified as a person under investigation. What are we seeing as far as children here? And I think that I want to bring that up because I think a lot of times people aren't thinking that this actually can affect children. And what are we seeing here, and what do you know?
Yeah, so again, as I've said for several weeks here, no one is immune, and no one is not able to get COVID-19. That goes from infants all the way up, to our senior level. So, it's no different in that fact. I mean, we have had obviously some children over the course of our last 6 weeks or so in tracking that have had COVID-19. Fortunately, we have not had any deaths locally around that. So that is a good thing, but children are just as susceptible as any other age group. And again, we all know that, unfortunately, again, that there are children with compromised immune systems and other health issues that they deal with, and they're no different than any other group that may be more susceptible to more severe outcomes potentially from COVID-19, which again reiterates the point of making sure we're doing our best to protect our vulnerable populations during this time.
Thank you.
Anyone has tested positive among staff?
So, hold on, Tom, you're breaking up. Can you start over?
Okay. Well, I wondered if any employees at the villages have tested positive.
Yeah, so again, we would track them in our community numbers. So we're only reporting the confirmed cases directly related to the residents at the facility. But I will say, yes, we have had positive workers at the villages.
It would seem like many of the staff would also be in the quarantine. I don't know if that's true, just because they're around so many residents who are positive.
Yeah, so again, this goes back to what we've talked about a few different times. If you're considered an essential worker, and again, there's a whole list of different essential workers, different essential businesses, folks are allowed to work if they're asymptomatic. There's obviously enhanced restrictions around them, enhanced monitoring of temperatures. So any folks, whether they're even isolated and or quarantined, there is a guidance document that's available that does allow them to work. And again, this is mainly driven out of the essential need of the work and the shortage of workers. And there's a high level of restrictions placed upon them in order to do that. So again, it's a mixed bag when we get into that as far as folks working in these environments. But again, there is a way that people can work as long as they're meeting the minimal requirements in monitoring.
Okay.
Other questions? Okay, well, we'll wrap it up then. Again, I appreciate everybody's time, and I'm going to encourage you, as I do every week, to go out there and be safe and continue to practice your social distancing and, wearing your mask if you're out in the different stores, and protect others as we go along. And again, we're going to continue to move through this as a community. We're in this together, and we're going to continue to provide you as real-time factual information as we can every day. So with that, I wish everybody a happy weekend, and we'll be in touch. Thank you.
Thanks, Paul.
Thank you, Paul.